Welcome to the Trey Hart Learning Channel. I am Ray Upchurch. Today on the Trey Hart Learning Channel, we're going to be talking about motivational interviewing. Stick around. Just a quick report on how I'm doing with my diet. Since last week, I have lost 1 pound. So for those of you that are keeping track, I've lost a total of 13 pounds since I've started, which means I have 11 pounds left before I start my next SMART goal. In today's video, I will discuss what motivational interviewing is and why you might use it as part of your approach to help you with your diet. Motivational interviewing is an interviewing technique used by doctors, psychiatrists, dietitians, nutritionists, health coaches, and other health professionals to help individual people enhance their own self-efficiency and personal control for behavioral change. In today's instance, I am talking about its use in diet and diet modification, but it has other applications and is commonly used not only in diet modification but other health modification such as smoking prevention, drug and alcohol abuse, just to name a few. With motivational interviewing, the questions asked address several aspects of change. During the interview, the interviewer helps the person discover their own abilities and helps that person find their own solutions. The first being how ready a person is. They are asked about their readiness to change by delving into their feelings about exercise and changing their eating habits. The person interviewed discovers how they would like their own health to be different and delves into how they feel talking about their weight. The second is how important it is for them to change. This is done by helping the person think about how things would be different if they were at a healthier weight. The person also thinks about what would happen if their weight does not change and helps them understand what is important to them and the impact that change would have in their life. This delves into the good things about this change, whether it's losing weight or healthier eating habits, and concerns that they may have about this change. The third thing is building that person's confidence. By helping them think about what would make them more confident, discussing how the interviewer can also help that person succeed based on that person's perspective. They will also discuss any previous attempts at health change and what that person found helpful and what their options may be for this change and any practical things they need to achieve their goal. The fourth thing discussed is what barriers might there be. This helps them understand what stands in the way of taking that first step and what might impede success, such as childcare, transportation, distance costs, and accessibility. At the end of the interview, feedback will be given to the person interviewed. During this time, the information gathered from their interview will be discussed, which can include feedback on these unhealthy behaviors that are harming the individual. The person is helped to realize their own responsibility for making the change or their own responsibility for making the choice to change, and helps them realize that only they can do this and that no one else can make this decision for them. Advice is given about the importance of making change in their lifestyle, with some suggestions on different ways this could be accomplished. This is done while reinforcing that the person will make the ultimate choice themselves. Different alternatives are presented to the interviewee, allowing them to have several things to choose from. One goal of motivational interviewing is to help the person become optimistic and more confident about their own abilities to make meaningful change. The Academy of Nutrition and Dietetics has shown that there is strong evidence for a treatment program to include a reduced calorie diet, physical activity, and behavioral therapy. When making any change in our life, it can be and often is difficult. Having someone help us in our discovery on how we can make a better health choice allows us to delve into resources that we did not always realize that we had. So if you have any questions about motivational interviewing, or you want to use it as part of your diet and health change process, I would recommend contacting a health professional near you. I have put some links below for some diet and calorie trackers that you might find helpful. If you've liked this video, please press the like button below, and if you are not a current subscriber, please subscribe. Next week, I will talk to you about diet sabotage and problem solving. See you then.